I think we have just about everybody. It's now my pleasure to introduce Dr. Charles Rothwell, who is another member of our committee from the National Center for Health Statistics, retired from the National Center for Health Statistics, but very much still alive and active. And a huge contributor, as you can see, and as you will learn. Thank you very, very much. So if you want to start the second panel on the Florida system, thank you.
Very good. I'm honored to be chairing this session, and especially with the people I have surrounding me who know much more, fortunately, than I do. And that's the reason why they're here. I think it's obvious from our conversation this morning and now with Florida that we have two different situations. And I'm not trying to be negative about anything at all, but certainly Puerto Rico had issues from an infrastructure perspective and a variety of other perspectives that Florida, fortunately, does not have. And Florida has an ability beyond many states, matter of fact, in my opinion, to make changes on their own, which they have done over the years. So I think this is going to be a very interesting discussion about how Florida operates, not just from a mortality perspective, but from a morbidity perspective, the information they've used, and how they've changed over time as they've had hurricane after hurricane after hurricane hitting them and other types of natural disasters. So with that, I think we have the right people here to talk to us today. The first speaker will be Stephen Nelson, who heads up the medical examiner system and is chairman of the Florida Medical Examiners Commission, and he's really going to give you an overview of how things work in Florida. Ken Jones, who's a state registrar, a longtime state registrar of one of our better vital statistic systems in the United States, will be talking to you from his perspective. Then we'll be going to a health officer from Jackson County who will be really telling you what it's like and what he has to deal with and what he needs from his perspective when these disasters happen. And finally, we're going to have the state epidemiologist, Corinna Blackmore, talk to us from her perspective about assessing both morbidity and mortality after disasters and at other times during her time in Florida. So with that, let's get going.